Most student paramedics don't struggle on placement because of their clinical ability. They struggle because no one teaches them this stuff. Hello and welcome to the first ever episode of Paramedic TV. My name's Tommy and this is presented by PocketClinician. So in this video, I want to talk about the biggest mistakes that student paramedics make whilst on placement. I'm not going to call anyone out, don't worry about that, but knowing these things can help you with your confidence when you head out on the road and do your ambulance placement shifts. You know that moment when your mentor passes you the ECG and you look at it and your brain just takes a sponsored holiday? So I've got my notes and we are going to go through the biggest mistakes that student paramedics make whilst on their ambulance placement. So let's dive straight into mistake number 1, trying to look good instead of just learn. And I understand why people do that. I mean, you're there, you want to be the best paramedic you can be, you want to go out there and save lives, and you want to be a clinician who's full of knowledge, but realistically, that's not the way that it works. We all have our strengths and our weaknesses, and even myself, I know that some of my strengths are ECGs, the cardiovascular exam, and things like that. And people constantly come up to me and say, "Oh yeah, what's this ECG like?" and that. But I've got weaknesses as well. I'm not going to go through them in this video, but we can't be good at everything. But as a student, you're there to learn on placement. You're not there to impress everyone. So try to avoid pretending to understand. And it's okay if your mentor explains something, or you go to a patient and you're not really sure what's going on, or you're not sure of a certain medication or a medical condition, then just ask. There's no point in pretending to understand just so that you look better than you are. And really, mentors don't expect you to know everything. They just expect honesty. Like I said, if you don't know something, speak up, ask plenty of questions, and you'll be absolutely fine, flying through placement. Mistake number 2, standing in the corner quietly. And this all comes down to confidence and your ability to socially interact with a team of people. And I completely get that. You're entering an ambulance where there's a team of 2 that already work together every single day, and it's really difficult to integrate yourself into that. But really, your mentor should be integrating you into the team. But still, don't stand there in the corner quietly. When you walk into a job, take a bit of equipment with you, kneel down next to the patient, and when you find a little gap in the questioning or something like that, then crack on with a set of obs, or in the back of the ambulance you can ask some questions. Really get stuck in. So again, it does take a bit of confidence to not do this, but try to avoid just standing there quietly, not doing much. Always find something to do. And if you're not sure what the best thing to do is at that time, then just ask your mentor. Just turn around to them and say, "Hey, look, is there anything that you want me to be doing right now?" And if they say, no, everything's fine, then yeah, it's okay to stand there quietly, not doing much, because sometimes on the job that does happen. But they might ask you to say, why don't you do a set of obs, or why don't you enter in their medications on the paperwork, or something like that. So yeah, most of the time there's always something to do, but just try to avoid standing in the corner quietly. To celebrate the launch of Paramedic TV, I'm giving away a student paramedic bundle. To enter, simply subscribe if you're watching on YouTube, or follow if you're listening on Spotify. That's it, and the winner is going to be announced on episode 5 of Paramedic TV. Good luck and enjoy the show. Mistake number 3, not talking to patients enough. Now, this is a very common one. Communication makes up 95% of the role of a paramedic. So as a student paramedic, you should really be focusing on these communication skills. And I get it. You learn how to do cannulas, and you learn how to drill into bones and all sorts of things. And those are the skills that students tend to focus on the most, because they want to get them out of the way and become good at them. But you can become better at those when you qualify. I think the best thing to do whilst you're on placement is hone down on your communication skills. Building a rapport with the patient is really important, and just understanding different communication styles of all of the diverse range of patients that we see, from little toddlers to really old people who might be hard of hearing, people with learning disabilities. We see so many different people that we need to adapt our ways of communicating with them. And the only way you're going to get good at that is practicing. Do your best to talk to patients whenever you can. And even if you're not leading the job or you're not attending this one, you can still grasp those opportunities to communicate, whether it's in the back of the ambulance where not much is going on, or if someone has gone to get a chair or to get a bit of kit, you can talk to the patient or even their family. And I still do this now because the ways that you communicate with patients, the things that you might say to them, the phrases and the words that you use to reassure them, you'll remember those, and you can take them so far into your career. So yeah, really hone down on those communication skills on placement. Mistake number 4, obsessing over the big jobs. And I know that that's what we train for. You go to university, you learn CPR, you learn major trauma, you learn catastrophic hemorrhage. But let's face it, that is only 5 to 10% of the patients that we actually see. And yeah, it does make the job a little bit more exciting when you go to to a major trauma or a big road traffic collision or something like that. But you really want to focus on those low acuity jobs as well. And for some of you, that might not be interesting, but unfortunately, that's the way the world is at the moment. We go to, majority of the time, low acuity patients, chest infections, cellulitis, mild pain, sort of all of these different things. And you can't obsess over the big jobs, because the more you go to the low acuity jobs, you're just going to get burnt out. And the last thing you want to do is become burnt out on placement, because how is that going to take you further in your career as a paramedic if on your ambulance placement you're already finding it hard to enjoy the job that you're learning to do? So stop focusing on the big jobs. Yeah, you'll go to a cardiac arrest and a road traffic collision, and you can learn as much as possible on those jobs, but don't go to work saying to yourself, yeah, let's go to a big job today, because the likelihood is it's not going to happen. I would go to work instead, or go to placement instead, and actually just ask yourself, right, I'm going to have a good day, the weather's good, I'm working with a good team of people, we're going to have some fun, help some lovely people, and get through it, and I'm going to learn as much as possible. That is the mindset that you want to have. Mistake number 5, not developing clinical reasoning. And, it's all well and good you knowing the physical assessments and reading ECGs and understanding observations and things, but if you don't relate that to the clinical context of the patient, and you're just going through the motions, oh, you've got some abdominal pain, yeah, I'm gonna auscultate your abdomen, I'm gonna palpate it and percuss it and then take you to hospital, that doesn't develop you into the rounded clinician that you probably want to be. So what you've got to ask yourself is this: what does this mean? So for example, you go to a patient, you get a detailed history because you're using Socrates, or you do a really in-depth physical assessment. Rather than just documenting them, asking yourself, why is this happening? And what can you do to fix those things? What is the most appropriate course of treatment for that patient, depending on my differential diagnosis? That is clinical reasoning. So yeah, stop just going through the motions, getting your history, doing your physical assessment, and then looking at your mentor on what to do. Develop clinical reasoning, and you will find it so much easier to create appropriate management plans for patients, and you'll feel a lot more confident about it as well. Don't get me wrong though, clinical reasoning takes a long time to master, and when I say master, even I haven't mastered it. So, it's something that you constantly get better at, but it takes years to grasp the concept of. Just remember, differential diagnosis, you're not just thinking about one condition. You can have a list of 3 or 4 different conditions that patient could be experiencing, but you use your clinical reasoning to work out which one it's most likely to be and then treat the patient for that. Mistake number 6, being afraid to lead the job. This is completely fine, especially first year. If you're in your first year student paramedic placement, you're not going to have the practical ability, that you haven't practiced enough, and you might not even have the knowledge around history taking and doing a physical assessment to lead a job. But by the time you're in second year, you should be able to be leading these basic jobs. But the thing is, what I find and what the point that I'm making about this one is those third years, and you know who you are, those third years who are sitting in the attendance seat and see a complex job come through. It might be like a mental health crisis, or it could be an elderly person that has really vague symptoms, and you look at yourself and think, oh, this might be a bit difficult to attend because I don't really know what's going on. And we're the kind of people that know our guidelines, that know our assessments, and we want to go in, know what we're going to do before we get there, and then treat the patient. But some jobs you don't know what it's going to be like. So, and I've had it before where some students say, actually, I'm not sure about this one. I think you should do it. And I try and get them as stuck in as possible, because remember, even if it's a really complex job or a really difficult patient to deal with or understand, you've got a mentor there to help you through everything. So talk to your mentor and say on the way to the job, look, I might need a bit of help with this, but I'm going to do it. Because the only way that you're going to get good at these complex jobs is if you practice doing them on placement. So yeah, stop avoiding leading complex jobs. Mistake number 7, taking feedback personally. And I do get it, because most mentors now are newly qualified. They're only 6 months into their career and they're being given a student to mentor. And that, I completely understand why that is difficult. And, we don't always get taught how to give feedback. And if you have a mentor that is fairly early on in their career, not particularly confident about their own ability to do the job, yet alone teach someone else how to do it, then the feedback that you get, they might be a bit stressed out. It might not be feedback that you necessarily appreciate. But just remember, don't take it personally. It's not a personal attack. It's just someone trying to help you get better at what you do. And like I said, it really does depend on the way that they give you the feedback. And I do appreciate that sometimes you're not going to appreciate the way that it's been given. But instead of taking it personally, maybe after they've given feedback, and if you didn't like the way that they gave you it, then just say to them, hey, look, I prefer being given feedback in this way. A common way that I give students feedback is I go from the start of the job, from the moment we walked in, and I review step by step every aspect of the job, and we go through what the student did really well, what they could have done better on, and then that way you're not just being hounded on all of the things that you weren't particularly good at, but you're also getting feedback on what you did well during that, and it then makes you feel a bit more confident on the things that you are good at, and then it leads you to actually want to be better at the things that you weren't so good at or need a bit of improvement on. So just remember, feedback isn't a personal attack. It's literally just someone trying to make you a better clinician. Mistake number 8 is not reflecting after jobs. Now, I've seen it before. Many students, they go from job to job to job, just, we'll practice this and I'll attend all day. Some people want to do that. But there's no time to reflect after the job. Now, the only way you're going to learn is by reflecting on what you've done. And you've got a mentor there to show you the ropes, show you where you've done really well, show you where you need to improve a little bit. And without that reflection period after, not every job, but after a couple of jobs, you're not going to know what you did well on or what you didn't do so well on. And then you'll go to your next placement block thinking, well, I didn't receive any bad feedback, so I must be all right. And actually, you might not be. So just remember, reflect on each job. Ask yourself, What did you do well? What was my working diagnosis? How did I come to that diagnosis? Was there any questions that I could have asked but forgot in that moment of time? What was my communication style like with the patient? How could I have adapted that communication style a little bit more to build a bit more rapport, make it a bit more easier to get a history? Did I conduct the correct physical assessment? Was I in depth enough? And what I do, I still reflect on jobs that I do now. And obviously, I'm a qualified clinician. Sometimes I'll be leading a big job, and I reflect a lot on my leadership skills as well. And even as a student, it's important to do that. And I ask myself, is there anything I could have done to make the team feel more at ease with the decision-making process? If I'm the senior clinician on scene, did I make everyone feel empowered that it was a shared decision as opposed to it just coming from me? And was everyone happy with just the way that I led the job? I really do think that reflection is such a key part of our role throughout your whole career on the only way that you're going to be able to improve as a paramedic. Number 9, poor professionalism. And I get it. Your mentor might be having a lark around, or might say, they might look at the MDT screen and say, oh, this is going to be a load of rubbish, or they might wind up a patient. But don't involve yourself in that. Be the clinician that you want to be. And remember, we have to act according to the standards that the HCPC set, and one of those is professionalism. So as a student, if you're not professional, then you're not setting the standards that the HCPC set us, and you might come into a bit of trouble when you qualify if you carry on acting in that unprofessional way. Now, I'm not saying that you are like this. I'm not calling anyone out, like I said right at the start, but it happens a lot. And I recently did a course, and paramedics make up of only a small percentage, 1 or 2% of all of the healthcare professionals in the HCPC, yet we have twice the amount of investigations, and majority of them is down to professionalism. And I get it. We're in an ambulance, just us. There's no manager looking down on us or noticing what we're talking about or the way that we act. And I think that causes a bit of leniency, and you get a bit complacent in the fact that there's no one there to rein you in. And as a student, if your mentor is acting like that, then you're going to take that upon yourself and take that on further in your career. You're going to pick up all of the different things that they say and do. And if it's unprofessional, then you might take that into your career as well. So just remember, set yourself to the side and just don't get yourself involved. If you notice something going on, then don't join in. Just sit back and think to yourself, no, I'm going to remain professional in this situation. I'm not going to join in with that. Sorry, I'll stop banging on about professionalism in the cab, but also as a student, you're there to show that you can do the job as a paramedic. So things like turning up on time is really important as part of the being professional. Wearing the correct uniform and adhering to the uniform standards, tucking in your t-shirt, being bare below the wrist is really important, because if you feel like a professional clinician, you're going to act like a professional clinician. If you've got your shirt untucked and your hair's all scraggy and you haven't ironed your shirt, then you're not going to feel as professional and as clean cut as what you might be trying to act like. So just remember that when you turn up on placement, get there nice and early. Don't use your phone on a job unless you need it for like an educational purpose. And turn up on time, adhere to uniform policies, and like I said before, be the clinician that you want to be. And we've come to the last mistake that I've written down, which is thinking placement is all about passing. Now, I get it. Placement is a pass or fail kind of test that you have to get through, but remember that you're there to learn, and it's a period of progression. It's not pass or fail. So you don't necessarily have to be at the best standard to pass. You just have to show that you're progressing and you're safe, okay? And I wrote down this quote. So, the quote, I wrote it, but I don't know if I can call it a quote. But I wrote, the goal isn't to survive placement, it's becoming the kind of clinician people trust. And that is really important. I see a lot of students, they've got lack of sleep, they're trying to do loads of things outside of placement. And I'm not talking about like essays or OSCEs. I'm talking about going out partying. And I get it, you might be young, and when I was that age, I probably prioritized those things as well. But just remember that placement, you get a long old placement block and you're there to learn. And you can ask as many questions as you like. You can attend as many jobs as you like. You can practice as many things as possible. You're inside the back of the ambulance. That's where everything is to do with the role of a paramedic. And you're there to learn and absorb as much information as possible. So don't worry too much about failing placement. Just make sure that you're staying safe, you're professional, and that there is a general level of progression. And if you focus on that rather than just passing or surviving, then you're more likely to pass, because it's the students that tend to have a poor attitude or are just trying to turn up, get it over and done with. They're the ones that get put on action plans and sometimes fail. They're eager students that are keen, ask lots of questions, really want to learn, get really stuck in. Those are the types of students that will pass every single time. So that is the 10 biggest mistakes that I see student paramedics make on placement. So I hope you found that helpful and you can take that along, broaden your horizons of what ambulance placement is like to give yourself the confidence to actually pass. Until next time, I've been Tommy, this is Paramedic TV.